Did you know that your sleep might be trying to tell you something vital about your health? Welcome to our video, How Your Sleep Reveals Hidden Signs of Diabetes. Here, we will uncover how disruptions in your sleep pattern can be an early warning of diabetes, a condition that affects millions globally but often remains undiagnosed. Have you ever felt extremely tired during the day, even after a long night of sleep? Or perhaps you frequently wake up at night for no apparent reason. These could be signs that your body is trying to communicate something important. By watching this video, you will gain valuable insights into the connection between sleep and diabetes, and how identifying these hidden signs can not only improve your quality of life, but potentially save your life. Stay with us and discover how to take control of your health, starting with the quality of your sleep. What is diabetes? Diabetes is a chronic disease that occurs when the pancreas does not produce enough insulin, or when the body cannot effectively use the insulin it produces. Insulin is a hormone that regulates the level of glucose, sugar, in the blood. Without proper control, blood glucose levels become elevated, which can lead to damage to various organs of the body, including the heart, blood vessels, eyes, kidneys, and nerves. Types of diabetes. Type 1. Diabetes. This form of diabetes occurs when the immune system attacks and destroys the beta cells of the pancreas, which are responsible for producing insulin. It usually manifests in children or young adults, but can occur at any age. People with type 1 diabetes need daily insulin injections to survive. Type 2 diabetes. This is the most common type of diabetes, accounting for about 90% of cases. It occurs when the body does not use insulin effectively, insulin resistance, and over time, the pancreas cannot produce enough insulin. It is strongly associated with being overweight, lack of physical activity, and genetics. Gestational diabetes occurs during pregnancy and usually disappears after childbirth. However, women who have had gestational diabetes are at a higher risk of developing type 2 diabetes later in life. Blood sugar control during pregnancy is important for the health of both mother and baby. Common symptoms of diabetes. The symptoms of diabetes can vary depending on the level of blood glucose elevation. Some individuals, especially those with prediabetes or type 2 diabetes, may not initially show symptoms. However, typical symptoms include excessive thirst and increased need to urinate, due to the excess glucose in the blood that the kidney tries to excrete, leading to dehydration and consequently an increased thirst. Constant hunger. Even after eating, because the cells of the body do not receive the necessary glucose to produce energy due to a lack of insulin or insulin resistance. Unexplained weight loss, mainly observed in type 1 diabetes, as the body begins to break down muscle and fat in an attempt to obtain energy. Fatigue. As the cells cannot obtain enough glucose, this can lead to feelings of tiredness and weakness. Blurred vision. Excess glucose in the blood can lead to changes in the fluids of the eyes, affecting vision. Wounds that heal slowly and frequent infections. High blood glucose can affect the body's ability to heal and resist infections. Dark, velvety patches of skin, known as acanthosis nigricans, usually found in the folds and creases of the body, indicating insulin resistance. Recognizing the signs and symptoms of diabetes is crucial for early diagnosis and to prevent long-term complications. If you exhibit any of these symptoms, it is important to consult a doctor for evaluation and possible diagnosis. The importance of sleep. Sleep is an essential biological function for maintaining physical and mental health. During sleep, our body performs several critical functions, including memory consolidation, hormonal regulation, and cellular repair. These activities are fundamental not just for daily well-being, but also for long-term disease prevention. Functions of sleep. Physical recovery. During deep sleep, the body repairs tissues, builds bones and muscles, and strengthens the immune system. This recovery is crucial for physical health and resistance to infections. Hormonal regulation. Sleep regulates the production of important hormones, such as insulin, which controls blood sugar levels, and cortisol, known as the stress hormone. Leptin and ghrelin, hormones that regulate hunger, are also adjusted during sleep, influencing appetite and metabolism. Memory consolidation and learning, REM, rapid eye movement sleep, plays a vital role in memory consolidation and learning. During this phase, the brain processes and stores information, consolidating learning from the day. Mental health. Adequate sleep is essential for mental health, helping to regulate mood and decrease the risk of disorders such as depression and anxiety. Effects of poor sleep. Lack of sleep or poor quality sleep can have significant detrimental effects on health, including increased risk of chronic diseases. Sleep deprivation is associated with an increased risk of developing conditions such as obesity, type 2 diabetes, cardiovascular diseases, and hypertension. Memory and concentration problems. Lack of sleep negatively affects cognition, attention, and problem-solving abilities, impairing academic and professional performance. Mood changes. Sleep deprivation can cause irritability, emotional control issues, and increase the risk of mood disorders. Weakened immune system. Lack of sleep weakens the immune system, making the body more susceptible to infections. Hormonal imbalance. Sleep deprivation can disrupt the production of important hormones, affecting metabolism, appetite, and stress. Therefore, the quality and quantity of sleep are fundamental to overall health. Adopting healthy sleep habits can significantly improve quality of life, reduce the risk of chronic diseases, and promote physical and mental well-being. Relationship between sleep and diabetes. In recent years, science has delved into the complex relationship between sleep quality and the development of diabetes, revealing significant connections that warrant our attention. Epidemiological and clinical studies have consistently shown that both sleep deprivation and excess sleep are associated with an increased risk of developing type 2 diabetes. A study published analyzed over 50,000 participants and found a direct correlation between short sleep duration, less than 5 hours per night, and a 30% increase in the risk of developing type 2 diabetes compared to those who slept between 7 and 8 hours per night. Similarly, sleeping more than 9 hours also showed a slight increase in risk, suggesting that both lack and excess of sleep can be harmful. Another research focused on the effects of sleep deprivation on glucose regulation and insulin sensitivity. The results indicated that restricting sleep to just 4 hours per night for a week significantly reduced insulin sensitivity, a known precursor to the development of type 2 diabetes. How sleep affects metabolism. Sleep plays a crucial role in regulating various metabolic processes, including how our body processes glucose. During deep sleep, the body works to repair tissues, regulate hormones, and consolidate memories, but also adjusts how insulin, the hormone that controls blood sugar levels, is released. Sleep deprivation negatively affects hormonal regulation, leading to decreased insulin sensitivity. This means that the body needs to produce more insulin to keep blood glucose levels stable. Over time, this condition can overburden the pancreas, contributing to the development of type 2 diabetes. Additionally, lack of adequate sleep can increase levels of cortisol, the stress hormone, which can also negatively affect insulin sensitivity. Another important aspect is the impact of sleep on appetite and food choices. Sleep deprivation is associated with an increased appetite and a preference for high-calorie and carbohydrate-rich foods, contributing to weight gain and the risk of diabetes. In summary, The quality and quantity of sleep have a profound impact on glucose metabolism and insulin regulation, two key factors in the prevention and management of diabetes. Ensuring adequate sleep can be an effective strategy to reduce the risk of developing type 2 diabetes, as well as being an important part of treatment for those who have already been diagnosed with the disease. How to detect diabetes alerts. The relationship between sleep quality and overall health is well documented, but did you know that your sleep pattern can reveal hidden signs of diabetes? Let's explore how sleep disorders can be associated with diabetes, which signs you should be aware of, and when it's time to seek a doctor. Sleep disorders associated with diabetes. Sleep apnea, a serious condition where breathing stops and starts repeatedly during sleep. People with type 2 diabetes are at a higher risk of developing sleep apnea. The condition can, in turn, make blood sugar control more difficult, creating a vicious cycle. Insomnia, difficulty falling asleep or staying asleep. Insomnia can be both a symptom and a contributor to elevated blood sugar levels, as lack of sleep affects how the body processes glucose. Restless legs syndrome. Although less discussed, this condition can disrupt sleep and is often linked to underlying health issues, such as diabetes. Signs to watch for frequent nighttime awakenings. Waking up several times during the night can be a sign of unregulated blood glucose levels. Difficulty sleeping. If you find it hard to fall asleep or maintain sleep, and this becomes a pattern, it may be indicative of underlying health issues, including diabetes. Excessive daytime sleepiness. Feeling exceptionally sleepy during the day, even after an apparently adequate night's sleep, may indicate that your sleep is not restorative, possibly due to disorders like sleep apnea. When to seek a doctor. Persistence of symptoms. If you notice a persistence in altered sleep patterns, especially if accompanied by other symptoms of diabetes such as excessive thirst, frequent hunger, unexplained weight loss, or fatigue, it is crucial to seek medical advice. Impact on quality of life. When the quality of your sleep begins to affect your daily life, mental or physical health, it's time to consult a professional. Before making drastic lifestyle changes, if you are considering significant changes in your sleep routine or lifestyle to combat these symptoms, a medical evaluation can help guide these changes safely and effectively. Diabetes is a serious condition that requires careful attention and management. Recognizing hidden signs, such as changes in sleep patterns, can be a crucial step in early detection and effective management of the disease. If you are experiencing any of these symptoms, do not hesitate to seek medical guidance. Prevention and control. Improving sleep. Quality and diabetes management. Healthy sleep habits. To improve sleep quality and consequently contribute to more effective diabetes control, it is essential to adopt healthy sleep habits. Here are some practical tips. Establish a routine. Try to go to bed and wake up at the same time every day, even on weekends. This helps regulate your body's biological clock. Create a comfortable environment. Ensure your bedroom is a sanctuary for sleep, with a comfortable temperature, minimal light, and no disturbing noises. Limit blue light exposure. Avoid using electronic devices such as smartphones and computers at least 1 hour before bedtime, as the blue light emitted by these devices can interfere with your sleep cycles. Practice relaxation. Relaxation techniques such as meditation, reading, or a warm bath before bed can help prepare your body and mind for a restful night's sleep. Diabetes control. Proper management of diabetes is crucial not only for overall health, but can also have a significant impact on sleep quality. Here's how. Monitor your glucose levels. Keeping a tight control over your glucose levels can prevent symptoms that disrupt sleep, such as the need to urinate frequently during the night. Healthy eating, a balanced diet, rich in nutrients and low in sugars and refined carbohydrates, can help stabilize blood glucose levels. Regular exercise, regular physical activity can improve sleep quality and aid in diabetes control, but avoid intense exercises close to bedtime, as they can energize too much and make it difficult to fall asleep. Importance of medical follow-up. Regular follow-up with healthcare professionals is vital for those with diabetes for several reasons. Treatment adjustments. The doctor can adjust your treatment plan as needed, which may include changes in medication, diet, and exercise routine. Monitoring for complications. Diabetes complications such as diabetic neuropathy can affect sleep. A healthcare professional can help manage these conditions. Support and guidance. Healthcare professionals can offer emotional support and practical guidance to deal with the daily challenges of diabetes and sleep quality. Adopting healthy sleep habits, properly managing diabetes, and maintaining regular medical follow-up are fundamental steps to improving quality of life. If you are facing difficulties sleeping or controlling your diabetes, do not hesitate to seek professional help. We have reached the end of our video, and it's crucial to remember the key points we discussed today. The relationship between sleep and diabetes is more significant than many imagine. Identifying hidden signs in our sleep patterns can be the first step in detecting or preventing the development of diabetes. Disorders such as sleep apnea, insomnia, and excessive daytime sleepiness are not just inconveniences, they can be indicators of more serious health issues. The importance of quality sleep goes beyond physical rest. It plays a crucial role in our overall well-being, influencing everything from glucose metabolism to our ability to maintain a healthy weight and a strong immune system. Therefore, it's essential not only to pay attention to the signs our body sends us at night, but also to adopt healthy sleep habits and seek medical advice when necessary. If this video brought new information to you or made you reflect on the quality of your sleep and your health, don't keep this information to yourself. Share this video with friends and family. You never know who might need to hear this message. Also, subscribe to our channel for more content like this and activate notifications to stay up to date. If you or someone close to you has identified worrying signs related to sleep, do not hesitate to seek a doctor. Prevention and early diagnosis are key to effective treatment and a healthier life. We greatly appreciate you taking the time to watch our video. We sincerely hope that the information shared here can make a difference in your life or the life of someone you know. Remember, taking care of your sleep is taking care of your health. Until the next video.